How can I reduce the risk of cannabis-induced psychosis? Are you wondering how to lower the chances of experiencing cannabis-induced psychosis? This is an important question, especially for those who may be at risk for schizophrenia. Cannabis-induced psychosis can happen when using marijuana leads to a break from reality, often showing up as hallucinations or delusions. This condition is closely tied to schizophrenia, a serious mental health issue that impacts thoughts, feelings, and behaviors. Understanding how cannabis affects mental health is key to managing risks. The active ingredient in cannabis, tetrahydrocannabinol, can change brain chemistry, which may trigger temporary psychotic symptoms. In some individuals, these symptoms can linger and may even lead to schizophrenia. The risk is particularly high for those with a family history of schizophrenia or other psychotic disorders. Several factors can increase the likelihood of cannabis-induced psychosis. Genetics play a role. If someone in your family has schizophrenia, you may be more vulnerable. Age is another factor, as young people are at a greater risk since their brains are still developing. The potency of the cannabis also matters. Using products with high levels of tetrahydrocannabinol can elevate the risk. Lastly, regular and heavy use of cannabis can lead to psychotic experiences. To lower the risk of cannabis-induced psychosis, consider these steps. First, the best way to reduce risk is to avoid cannabis altogether, especially if you have a family history of schizophrenia or other psychotic conditions. If you choose to use cannabis, opt for products with lower tetrahydrocannabinol content. This can help minimize the risk of experiencing psychotic symptoms. Next, keep track of how often and how much cannabis you use. Limiting both frequency and quantity can help prevent negative effects. If you notice any signs of psychosis, such as changes in behavior or mood swings, seek professional help right away. Early intervention can make a big difference in mental health outcomes. Having a strong support network is also beneficial. Friends and family can help manage stress and provide support, reducing the urge to use cannabis as a coping mechanism. In the context of schizophrenia diagnosis and early signs, especially during the first episode of psychosis, it is essential to be aware of the role cannabis can play. Early signs may include changes in behavior, mood swings, or difficulty concentrating. If you or someone you know experiences these symptoms, particularly after using cannabis, it is vital to seek professional help promptly. Mental health professionals can offer guidance on managing symptoms and preventing further episodes. By understanding the risks associated with cannabis use and taking proactive steps, individuals can lower their chances of experiencing cannabis-induced psychosis and potentially prevent the onset of schizophrenia.